KUZZ.
Hey, I just wanted to let you guys know it's raining in Belridge.
Oh,
Raining in Belridge.
That sounds like a Keith Urban record.
It does sound like a country song.
No, it sounds like a Big House song.
Now, Belridge is out by where? Taft?
Yeah, basically.
Belridge?
North.
Belridge is out past Button Willow.
Yeah, I don't want you to go in details because Jeff will start going into highways now.
33.
I knew it. Yeah, 33 to 16, which confuses me. Thank you, baby girl. I just hate that when they do that. I'm not a highway kind of guy. You know, all I know is you take, like, this road here and you turn there and you go. They have them all memorized, you know.
Perfect. Yeah, well, that's Belridge be off 33 there.
Yeah.
So if you take 58 out, then you turn north or right at the little junction there by McKittrick.
Then they told me, after all the years I've been alive, that the ones that are, odd, go north and or something. One goes north and the others go, you know. How was I to know?
Well, did you ever read a map?
No, not really.
Okay.
No, I didn't. Want to introduce our guest?
Dr. Jim Knoetgen, correct? Did I get it?
Correct. Good morning.
Knoetgen. See, I had questions, and I said, we're just going to call him Dr. Jim.
That's fine.
From Butology is here, and like Dr. Shaw told us last week, he concentrates on the non-invasive, kind of the Botox thing, and then he says, you want to talk the other stuff, like the sculptings and the enhancements, you want to talk to Dr. Jim, and he'll be in next week, which is, lo and behold, today.
Yeah, and what a delightful doctor to have in the studio. We've been grilling him about where he's from and how he got here. Great story. I love this. And you're enjoying Bakersfield, aren't you?
Oh, absolutely. I love it. I've been here for about 2 years now, working with Dr. Shaw and his brother over at Butology. Having a great time and love this town. My
gosh. Well, here's what we want to do this morning. If you guys have questions, chicks, guys, whatever, because I was talking to the doctor, 10-15% of guys now are having cosmetic surgery, aren't they? I mean, different things done.
Absolutely. We get a lot of men in all different ages looking for facial surgery as well as liposuction, all sorts of interest out there.
I know. It's kind of wide open now. There's so many procedures that can be done. So if you're curious about procedures, if you're a candidate for us, this is a great time to call. Dr. Jim is here. He'll answer your questions. We'll tell you all about what's happening. Did I miss anything?
Just what is your area? You have a number of areas of specialty that you kind of work in.
Yes. Well, I'm a board-certified plastic surgeon, so I'm certified to operate on every part of the body, but my area of specialty is breast and body contouring, so I do breast augmentation, tummy tucks, liposuction, the so-called mommy makeovers. That's generally my area.
I was going to say, so we can talk about mommy makeovers this morning. Cool.
Absolutely.
All I know is it made me uneasy. He was staring at me, and I was thinking, what is he thinking?
He says, can I work on your moobs?
Well, he just like we said, there's so much, Steve. So if you have a question, give me 842-5555. Did you just stop staring at me? That's it. Good morning, KUZZ.
Hi, I have a question about brow lifts. Is that okay?
Okay, go ahead.
Okay. I have the option right now to have the brow lift where they go in with and just put a few stitches over the upper outer edge of the eye, or the complete brow lift. And I'm only 40, and I have very saggy eyebrows. So would it be wiser to have the complete brow lift as opposed to just a few stitches on the side?
Well, that's a great question. Thanks a lot for calling in. And it's kind of difficult to answer the question without actually seeing your face, because you don't just want to evaluate the eyebrow. You want to look at the entire the forehead, the eyebrow, and the eyelids. So the two operations you mentioned are both definitely good operations. And the best thing to do is to get a consultation by a board-certified plastic surgeon like we have at Butology, and we can talk to you about all the different options and what may work best for you. All the consultations are complimentary, and you're welcome to call and come in anytime.
So they're free.
They're always free.
I've met both Dr. Shaws, and they are just absolutely incredible. I love them. They're both so friendly. Haven't met you yet, Dr. Jim, but I will.
Oh, that's great. Thank you.
Oh, he's great. I'll tell you that. Well, thank you, my love.
All right, thank you. Bye.
Bye, darling. Well, hey, we're taking questions. If you have questions for Dr. Jim, he does your augmentation, like breast augmentation.
Correct.
Then I call it the vacuum cleaner thing, but
the sucky thing.
The sucky thing, yeah.
Right.
But that's becoming pretty big, and they say once you suck the fat cells out, I mean, in other words, that's gone.
That's
right?
correct. We all have a limited number of fat cells, and once you've removed those fat cells, they're not going to come back. Now, having said that, liposuction or tummy tuck is not a weight loss technique, so they're not going to lose weight by doing it. So you definitely want to maintain a good diet and a healthy lifestyle. But certainly, once you remove those fat cells, they're not coming back.
So for instance, let's say that you want to make a change. You don't like your dimension. Mm-hmm. You go on your diet and exercise. You get down, and there's that pesky stuff that's left. That's the lipo stuff, right?
Exactly. That's the stuff that you want to treat with liposuction. Those problem areas that both men and women get that we can't get with the diet and the exercise.
Love handles.
Exactly.
So, why are you both staring at me again?
No reason. I don't need.
Good morning, KUZZ.
Good morning, guys.
Yeah.
Howdy.
Hey, I had a question for Dr. Jim.
Yeah.
Are you familiar with the Medtronics, the intrathecal pumps that control pain?
Yes, we have actually a type of pain pump that we use.
I'm on my third one, and it's never healed correctly where we're supposed to adhere to the abdominal wall. So I'm wondering, can that be corrected with some type of tummy tuck or...
Oh, I see. So you did not have plastic surgery. You now have an intrathecal pain pump.
I can barely hear you.
So you did not have plastic surgery. You have the intrathecal pain pump. Is that correct?
Right.
Okay. Well, it would depend on what exactly it looks like, and you're certainly welcome to come in for a complimentary consult. We'll take a look to see if we can straighten that out for you.
Wonderful. Thank you.
You're welcome.
KUZZ, good morning.
It's Toyota's National
Good morning.
Sale. The perfect.
Good morning, KUZZ.
Yeah, good morning.
Yeah.
I wanted to find out if there's a procedure for the underarm wing flap thing.
The wing flap thing. Is there a technical term for that?
I love the way she said it. Yeah.
I think it's technically the underarm wing flap thing. But okay, hear that a lot. And there's if you have a little bit of fullness, then certainly a liposuction can help with that. But if there is loose, saggy skin, then removing the skin is very helpful. And both of those procedures work really well.
So it's like a tummy tuck on the arms.
Exactly.
An arm tuck.
And I think that's probably one of the biggest things that I hear from women that they feel self-conscious about is because as you get older, you can't help it, and you get that excess skin like my cheeks. I look like a St. Bernard. But, yeah, you're looking good. You're on my video phone, by the way. You look fine. But
okay, thank you.
You bet. And if you have a question, the doctor's going to be with us for about another 15 minutes, and he'll be answering those. Dr. Jim with Butology, who does... all your augmentation and what they call them, arm flaps, and I'm a country boy. You know what I mean? I just say it like it is. But if you have a question or anything that you've ever wanted to know, feel free to call. We're just country folks, and we're answering them this morning. It's a crazy town. It's Bakersfield, California. The Graduates and Jeff Emery. Good to be with you, my country buds. KUZZ, good morning.
Hello, I have a question for the doctor.
Okay. Go ahead.
Okay. I have lost a lot of weight, and I am interested in some kind of tummy tuck or liposuction, but I also have a hernia in that area. So do I go to a regular surgeon for the hernia or a cosmetic surgeon?
That's a great question. First of all, congratulations on the weight loss. That's fantastic. A lot of times when we lose weight, we can get a lot of loose skin as well as some residual fat, and a tummy tuck is a great way to treat those, and you can develop hernias. So I would start by seeing a board-certified plastic surgeon who's usually qualified to take care of at least smaller, less complicated hernias, so you may just be able to get it all taken care of in one shot. But of course, if it's bigger and more complicated, then we would get someone else involved who is an expert in that area.
Does that work for you?
I think so. Thank you very much.
You betcha. KUZZ, good morning.
Good morning.
Yeah.
A week or so ago, you guys had talked about a barbecue cook-off in Bakersfield.
Yeah, that's this weekend over at Stramler Park.
At what park?
Stramler, over by the ballpark.
I'm sorry, I didn't catch that again. I'm not in the area.
Yeah, it's Stramler Park.
It's
Stramler.
Yeah, Northchester over by the ballpark.
Next weekend.
Okay. And it's Saturday and Sunday, or just...
No, it's Friday and Saturday, the 21st and 2nd.
Okay, very good.
You bet. KUZZ, good morning. Hello.
Hi, can I ask Dr. Jim a question?
Sure. Go ahead.
Oh, it's time right now?
Yeah.
Yeah, fire away.
Okay. Is this Dr. Jim?
Yes, it is.
Yes.
Go ahead.
Okay. Well, I've lost a significant amount of weight, and so I have that, apron kind of hangy thing in my stomach.
Right.
But just below that, I've got, I would say it's like a pocket of fat that's right over...
I know what you're talking about.
Right. Mm-hmm.
Okay. So when you do, I've seen this procedure done, and so I'm wondering, when you do the tummy tuck, can you also do liposuction in that area to get that?
Yes, you can.
And,
Yes, you definitely can. The tummy tuck tightens up the tummy, but it also lifts that area, and you can liposuction it as well to make it nice and tight.
It's bikini time for you again.
There you go.
All right. I will be in for a consultation.
Sounds good, baby girl. Bye, darling.
Thank you.
You know, I bet that is one of those things that, you think, I bet this can never be handled. Then all of a sudden you find out through cosmetic surgery, you're back to, like you said, wearing a bikini again. It's got to be a great feeling.
Right,
you know?
Absolutely. It really is very helpful for folks.
By the way, we got to tell you how you reach the folks over at Butology, Dr. Jim. Call them 327-3800. It's 327-3800, and you're right over on Commerce Drive, where they're right not too far from AAA Building, if I remember right.
Exactly, right down the street.
Cool. So that's easy to find. Just pop in, get your consult done. And
you probably have a website, too, don't you?
We do. It's Butology.com.
See? It always has .com at the end of it.
A lot of folks are going, how do you spell it? But, yeah, it's B-E-A-U, just like you'd spell Bo. And then the Tology part is T-O-L-O-G-I-E.
Okay, Butology.com.
Right.
And on there, it probably gives you a lot of the answers that you want.
Absolutely.
But call the office. Great people. This is not one of those intimidating things. Don't be intimidated by this at all, because we have met the doctors. They're fabulous. Give them a call. The consultations are free, which, to me, if it's free, it's for me. I mean,
I'm surprised you haven't been over there yet.
I hang around offices if it's free, and I don't even need the work. It's just, what do you think? Yeah, and they run me out. They go, come on.
Great atmosphere, too. It's not just the surgeries and the laser stuff. You got a spa over there. You got massage stuff. I mean, there's all kinds of stuff.
You betcha. Well, stick around, my friends. ZZ, good morning.
Good morning. How are you, Steve?
Real good.
Good. I'm glad to hear that.
What's going on?
I'm sorry?
I said, how can I help you?
I had a question for the doctor.
Sure, go ahead.
Is there a relatively simple procedure that can reduce underarm sweating?
Well, that's a great question. We see a lot of folks who are interested in that. There are a couple of options. There are non-invasive options where some things can be injected to help decrease that, and then there are also more invasive surgical options. So the great thing about our office at Butology is that we have doctors who do both of those procedures, so you can make an appointment and come in and see 2 or 3 of us to talk about it and find out what option is best for you.
Okay, do you know if any of those procedures are covered under health insurance? And are they relatively safe for a teenager?
Well, in terms of the insurance question, it's kind of tough to answer because all different insurance companies cover different things. And for certain procedures, we will take insurance. So you're more than welcome to come on in for a complimentary consultation, and we'll talk to you about it.
Okay.
Yeah, just bring your insurance, and they'll check on it for you.
Yeah, absolutely.
Okay, and you think that that's relatively safe for a teenager?
Well, but we wouldn't do anything that's not safe. So, once we figure out exactly what the situation is and what procedure will be best, we can talk to you in a lot more detail about that.
Okay, well, thank you so much.
Yeah, it's very common. I've heard that a lot. I mean, that's an interesting question. Thank you. That is, I mean, some of the things people bring up, I didn't even think about. Now, one you brought up just a minute ago was about the remember you talked about
knees.
The knees.
Inner knees, that's right. That's it's surprisingly an increasing area of interest. A lot of people have fat deposits on their inner knees, which just does not respond to diet and exercise, so we tend to do a lot of liposuction there, and a lot of folks just don't realize you can treat that area in many areas with liposuction.
Is that just a natural place for fat to land?
We all put fat in different areas, and sometimes women and men will both get these fatty deposits on their inner knees.
I'll be darned.
They don't like the way it looks in shorts, so we can treat that with liposuction.
He stores all of his in his head, so that's where his extra goes.
But with the St. Bernard jaws, it looks it's balanced.
Well, ask him to do his Nixon imitation. It looks really good.
Well, hey, thank you.
I just want to cover something quickly, just to follow up on a little bit on what that lady was asking. The key word when it comes to insurance with a cosmetic procedure are the 2 words medically necessary, correct?
That's correct. Like, we see a lot of folks who lose a lot of weight after gastric bypass or lap band surgery or just exercise and diet, and a lot of times they'll get huge rolls of skin that insurance will pay to have removed because it's causing medical problems for them.
Okay.
That's great. So, again, how you find the folks at Butology, they're right over on Commerce, 4850 Commerce, which is right over by the AAA building off Truxton. 327-3800. Your initial consult, free of charge.
Absolutely. They're all free of charge.
And you couldn't go to nicer people, and we've grilled him like a tuna fish.
Oh, yeah.
About whether he would do unnecessary stuff. Now, in L.A., you see these people that, like Kenny Rogers.
Unscrupulous.
He never had that done at Butology, I can tell you that.
Yes, true.
He's got clothespins on the back of his head. But
that's what I like about you guys. You'll turn down somebody and say, no, you do not need this done.
Oh, absolutely. Safety is always the number one concern.
Yeah, this is Bakersfield, and I think you'll love that. By the way, Butology is sponsoring the bus to Tim McGraw, which goes to Fresno. They also sponsored the Carrie Underwood bus that leaves tomorrow night from here, and I thought this would be a good time to do this.
KUZZ has $10,000 cash for you.